Hi, everyone. Thanks for inviting me. I'm really honored to be here. As she mentioned, I'm Dina Maron. I'm an editor for Medicine and Health at Scientific American. I'm also an MPH, and I'm tasked with giving sort of the journalist perspective. So in a short 10 or so minutes, I'm going to breeze through how journalists decide traditional versus digital media when it comes to writing a story or broadcasting a story, how news is covered quickly during an outbreak, and then I want to talk about when misinformation can go viral on social media, and hopefully of use to all of you what you can do about it and how to better interact with journalists so that we all get to the best end. So a bit of context. Maybe, let's say, a decade ago, you'd think a story was successful if it got above the fold in the New York Times, if there was an article in Time magazine about it. But now we might know that in terms of eyeballs on a story and getting your message out, more people are actually getting their news digitally. So a story at, let's say, NewYorkTimes.com or ScientificAmerican.com would actually reach more people than the magazine or the print version of those stories. And especially when it comes to something like an outbreak of an infectious disease, it might be better to think about something that can have a real timely impact, and that would be a digital platform. So I'm going to pull back the veil a bit on how we make our own decisions in journalism about if you're going to do a print story or a web story. The type of questions we ask ourselves, like you ask in the public health community, or who are you trying to reach? Questions about, do you want to write a story? Do you want to do a Q&A, a graphic, a podcast, a video? And those all depend on what's the message you're trying to get out. You know, is it about getting quick facts out there? Is it about an explainer to make someone understand something like, let's say, Zika that people had never heard of at a certain point? Is it something that people would best benefit from having a variety of voices, a variety of perspectives, whether it be a responder in the field, a doctor, a great communicator like Tony Fauci telling you why you should be worried about this and where the knowledge is at that time, that sort of thing. So this is an example of where digital media was really much better than print media for us. So last January, when Zika was still relatively new to the United States audience, CDC wasn't yet tracking and publicly announcing where Zika cases were in the United States. At that point, all Zika cases were travel-related up until that point. So I thought it was valuable for our readership and for the greater public to know that Zika wasn't entirely new to the United States. In fact, the first case that had come to the US was in 2007. And a person who lives in Alaska was a volunteer trying to help with an outbreak in Southeast Asia. And so anyway, I called all 50 state health departments in DC and got information about where Zika cases had been in the past and continued to update that every day for a couple months until CDC started publishing that information. And we had an interactive map on our website, and a variety of public health departments actually would use our resource to better understand what was happening contextually. And so this was an example where later on we took a version of this map and we put it in the magazine. But in real time, it was most useful to our audience because you could get daily information. And it would say at the bottom of the article when it was last updated, and obviously it was useful for that reason. We were also tracking where the travelers who had encountered Zika had been, which was something that for privacy reasons, CDC was not tracking on a larger scale, but state health departments were. So they gave us that information. So a good question is, where do infectious disease stories come from? From a journalism perspective, we might get those stories from a researcher, a physician, a health department or an agency, an advocacy group, crowdsourcing. It could be we hear a blip about something on Twitter, on Facebook. And our goal, of course, would be to get out the facts, to dispel rumors, raise awareness, humanize the problems. So not that different from general public health goals in many ways. So social media is obviously changing this landscape for us. Just as in public health, where there's no more one-dimensional communication where a bulletin is sent out and we get that information just there, it's much more dynamic. People are getting their information from a variety of media sources, from social media. For example, following the Boston Marathon bombings, a fourth of Americans looked to Facebook, to Twitter, to other social media networking sites for information, according to tracking from the Pew Research Center. And that's really kept up with a variety of both public health disasters and greater emergencies. People are looking to social media. And that can be a good thing because from a public health perspective, you can get your message out quickly, as people talked about a bit this morning, but obviously can also fuel problems if the information that's getting out there is not accurate and someone has a large following or a tweet goes viral and then you're in trouble. An example of that I want to talk about was with Ebola. So 2 years ago in August in Nigeria, an undergrad student, some of you might be familiar with this example. She, as a joke, tweeted out, "The Ministry of Health is urging the public to prevent Ebola attack by drinking salt water or bathing in salt water." And then just within a couple days of that tweet going out, the tweet had gone quite viral in Nigeria, and 2 people died and 20 more were hospitalized due to excessive consumption of salt water. And some of these people that had these negative outcomes, they were vulnerable for other reasons, high blood pressure and so forth, that predisposed them to have a problem with high salt content. But this is an example where obviously a tweet from just a normal person went viral, and public health responders were not able to catch it and respond quickly enough. Federal officials in Nigeria did step in, and by October 10th, due to intensive social media work, there were almost no tweets mentioning the bogus treatment anymore, but that doesn't change the fact that 2 people had died and 20 people were hospitalized. So what can you do? For the audience of public health experts and responders in here, I wanted to touch on some of these basic questions about getting the accurate information out there before rumors take hold. And that can involve doing a press conference, more traditional work, but also being vigilant online to see what misinformation is spreading, maybe tasking people with actually just in the face of an emergency, watching those platforms. And I wanted to mention as part of that, you should be sure to value digital as well as print media for the reasons that I was talking about. But one of the most important recommendations I can make, and it's maybe slightly at odds with some of the data that Dr. Fagelman mentioned this morning, is that I think it is really valuable to also say what you don't know. I think as quickly as possible, letting people know the information you do know, saying that the information is evolving, but also saying what you don't know is just vital, both for journalists who are crafting the story to make the public understand what's going on, but also because I think it does, in a lot of contexts, gain a lot of trust. If you think of some really great public health communicators like Tony Fauci or even Tom Fridan over at CDC, they are telling you this is the information we have now. It's changing on a day-by-day basis. This is an evolving landscape, and you don't think less of them or think they lied to you, or I think it actually helps everybody to understand the fast-moving target that's ahead of us. So I'm happy to dive more into all of this and how the stories get packaged in the Q&A, but I didn't want to go over time. So thanks.